Welcome to our panel discussion on global surgery, finding science, collaboration, and innovation for global health transformation, brought to you by InciSioN Global. So, global surgery is pivotal for ensuring equitable access to safe, effective, and affordable surgical care worldwide, transcending geographic and socio-economic barriers to improve health and quality of life. Thank you to all our panelists and participants for joining us today. I'm Arulselvi Manoharan, a junior doctor from Malaysia and part of InciSioN IT Advocacy team. I will be the moderator for this session. And so our flow for today's session is we will be having a brief sharing session from all of our panelists, followed by a question and answer session. Later on, we will also have my colleague, Meyrem, from Advocacy team as well, to handle the Q&A session and continue the panel discussion. So without further ado, let me introduce our panelists. Thank you so much to all of our panelists for joining us today. So firstly, we have a total of 4 panelists. Firstly, we have Mr. Djoken. He is the chairman of the U.S. National Commission for UNESCO Clubs, Centers and Association and executive director of Washington, D.C. based UNESCO Center for Peace. So he's a global advocate for social justice, human rights, expert with extensive public speaking experience in domestic and international settings. He is known for his passion for bridging the gap between the have and have not with a documented track record in diversity training, public relations, leadership, and international affairs. He has won awards that include the Gandhi Peace Award, the Nikola Tesla Global Forum White Dove Award, Justice Thurgood Marshall Award, and many more. Thank you for joining us, Mr. Djoken. Next up, we have Dr. Madani. Dr. Katayoun Madani is the MD Anderson Fellow in Global Surgery Policy and Advocacy at the Baker Institute for Public Policy and Department of Surgery at Baylor College of Medicine. She also serves as a global surgery clinical instructor there. Her current focus areas in policy research are access to trauma care and equitable bi-directional academic global surgery exchanges. She is a past chair and a member of the board of directors of InciSioN. So we call her as our very own. So she has extensive experiences developing cross collaborations among global surgery organizations. Dr. Madani serves as the first vice president of internal affairs of the Association of Academic Global Surgery and has had an instrumental role in creating membership and involvement opportunities for students and trainees in the organization. Next up, we have Ms. Almontaha Hassan, who is a research and programs assistant dedicated to advancing food security, humanitarian needs, and surgical development in Sudan. She holds a bachelor degree in business administration and an ECBA in business analysis. Her journey in surgical development began with volunteering at the Sudanese Consortium for Surgical Development. She is also the communication officer at the Sudan Food Security Information Consortium and the HR director at SCSD. Her diverse experience spans NGOs, companies, and startups, providing a balanced perspective on for-profit and also non-profit sectors. And our final panelist would be Mr. Santiago Guzmán Rico, a medical student at Columbia and a UNESCO Youth Ambassador. He leads a UNESCO summer camp each year in Washington, maintaining a strong foundation in encouraging youth activism and political engagement. His unique perspective as a youth ambassador himself from a young age has prepared him well for the challenges of the future. So I would like to welcome all our esteemed panelists on board. And firstly, our panelists will be having a brief sharing session. I would like to pass the floor over to Mr. Djoken. Sorry, sir, you're muted. Sir, could you please unmute yourself?
Okay, can you hear me now?
Yes, we can hear you.
Okay, sorry about that. Hello. So I'm really, first of all, thank you for the opportunity of being here with you today. I'm very impressed by the level of all those who will be speaking after me. And being the only one that's not in the film industry, it's kind of an honor to be the one to speak before you. And I would like, first of all, to give my thanks, okay, and congratulations to all the young people who are here today, who have made this possible. I think one of the reasons I'm here is Dr. Santiago, who, again, I've done a lot of things in my life. We have a number of programs with the UNESCO Center for Peace that we do. We've been doing for more than 20 years in the United States. And, when we've seen so many young people come around our ranks and go and do other things. And Dr. Santiago is one of those who are the proudest because he came on board, I think he was around 16 when he joined our programs. And again, when we say youth ambassador, say, what is that? Yes, he was the youth ambassador for Colombia. And once a youth ambassador, always youth ambassador, but it's far past that title, okay? He has past that title. But we also have within our UNESCO Center for Peace a group called SGD3. I'm sure I don't need to tell anybody here on the floor what's SGD3 about. And these are also young people that every year, many of them actually came through our program, but you know what? They went, get their medical degrees, and continue to help make the world a better place. They've been in Uganda, in areas where there are a lot of challenges, but they've taken time, their own resources, sometimes their own money to pay for a plane ticket to go other places and help. So I'm saying all this to say what? We all know that the world is going through a very difficult time right now. Look at what is happening in Gaza, totally unacceptable. You look at what's happening in Ukraine years later. You see what's happening across the level of poverty and reach a certain level. At the same time, you have individuals, one person making billion, enough money to enough money again in such a way that many countries, I would say countries in Africa, will never have that amount of money. So you have this disbalance that's causing some of this. And being someone, I was born in Africa as an African, but now an American citizen, when I see how many health clinics, how many health are being creating every day, sometimes I wonder, is it because people are getting sicker or because we're having more population? And sometimes, that's a question that I have all the time. That's why when I was invited to CSO, this is a great opportunity to share my hope. Again, not my fears, even though we are going through all these challenges. When I have young people like you that are committed, I just want to tell you one thing that's very important. Some of the major laws, international laws that are used right now, especially the one in terms of war, was developed or proposed by NGOs. We should not think that NGOs take a second seat when it comes to government. In order to elaborate that idea, I will tell you exactly how UNESCO Club Center Association started, right? After the Second World War, the world was in shambles. Okay, there was a need to create a new institution like the United Nations. When they were creating that institution, some people in Japan that are the only country to have witnessed 2 atomic bombs, heard about the idea. And the idea was so powerful for them to say this was so important, leaving the hands of government. Of course, at that time, government is the only one who have monopoly of terrorism, had the right to kill other people. So when I say that they created a UNESCO club at that time, and then later on, the organization realized that it was very important to use that tool to help make the world a better place. What I'm trying to do is that every single person should know that the things you are doing here doesn't have to stay just among the civil society, okay? You should dare to propose law, to propose and make activism what it is. I'm here for the first time. We're talking about innovation, what is going on in Africa, in some of the remote places where people don't live under $1 a day. Okay, how can you help in a situation like that? So I'm here to say that I'm really committed. I'm really proud about what each one of you is doing. I know the job is not easy, but I'm making myself available through the network we have across the globe to see how we could do, each one of us. We don't know how long we have on this earth, but each one of us has a responsibility. And then by working together, that innovation you are talking about is not just for having technology in hospital, but making sure that every single human being have access to health. Without health, there's nothing left. Okay, thank you very much. I look forward for the Q&A in order to share more of my experience and my knowledge. Thank you.
Thank you so much, Mr. Djoken. Yes, your journey is truly inspiring, and we are really grateful that you have joined us today. Thank you so much. It's a great pleasure to have you on board. So
Thanks.
next up, I would like to invite Dr. Katayoun Madani for her sharing session.
Thank you so much for organizing this event, and I'm really honored to be amongst the speakers on this panel. Really excited to hear all your experiences and thoughts. I put together some slides last minute, really, just to talk a little bit about something different. I know you asked me to talk about my experiences, but InciSion's my home, and I thought instead of talking about me, I'd talk about you. So I just want to share this. I'm going to be as fast as possible so that we can get to Q&As. So I want to talk about what the youth, the students and trainees have done so far in global surgery, where we came from, where we are going, because I think that's been very innovative. And we are talking about that not only here today, but the conversation is ongoing right now at the Summit of the Future Action Day, and the youth are talking. So I think this is very opportune moment. So looking back in time, it was, in 2014 where we had the first policy statement that actually came from the International Federation of Medical Student Associations, IFMSA, by some individuals who were very excited about access to surgical care and talking about what the students and trainees could contribute in that sphere. The conversations led to a call that led to formation of small working groups in global surgery, which eventually led to formation of InciSioN. In 2015 was the first time that the World Health Organization actually passed a resolution that had anything to do with surgical care, the 68.15 resolution that we all talk about very passionately in global surgery. At the same time, those same members of the student and trainee community who were interested in global surgery were actually on the ground in Geneva advocating shoulder to shoulder with the giants of global surgery, and they named May 25th Global Surgery Day. That was the first time Global Surgery Day was announced and celebrated. It was done by the members of InciSioN, and the national working groups were formed really in a formal way, going from a think tank to actually forming chapters locally. In 2016, there were 6 of them. I will not share which they were, but there were 6 across WHO regions, and they came together. And unfortunately, within the last 2 years of this process that I talked to you about, IFMSA decided that surgery was not really ranking in their bandwidth for the priorities that they needed to set. So the national working groups that were formed, or the small working groups that were formed, came together and formed what is known as InciSioN, and formally established InciSioN in 2017 as a non-for-profit organization in Belgium. Looking back in a 10-year course to today's InciSioN, which this was our old logo. There's another one I didn't put up, but I don't know how many people had seen this. I thought it would be interesting to see the logo evolution. I want to talk to you about the evolution of the roles of students and trainees across this last 7 to 10 years. So you wanted to talk about advocacy. I often start talking about advocacy and looking at the levels of advocacy that exists. And we have, local, we have community or regional wide, and then high level global advocacy. And I want to show you some of the things that the students have been able to achieve in the last 10 years. We have had campaigns in collaborations with the World Federation of Societies of Anesthesiologists and Lifebox and so on the local level in countries. We have delivered cargoes that have furnished, operating rooms and ICUs in the island of Grenada. We had in Malaysia a program that was a collaboration between the Ministry of Health and InciSioN Malaysia that was preventing road accidents and motor vehicle accidents, and it was multi-pronged. And you can see Chairs of InciSioN Malaysia in the background of this signing. And we have on the regional level with Global Surgery Day, this is one of the very first Global Surgery Day promo graphics in 2016, come together with partners like Lifebox to create a message around surgical care, to be the voice for the neglected surgical patients. Global Surgery Day now is celebrated as an entire week. It is celebrated across the community. Everybody wishes each other happy Global Surgery Day, which is quite a feat, because then it's recognized it's a day that we talk more about surgical care. Our advocacy efforts in promoting access to surgical care has been studied and published. Our Global Surgery Day campaign was reviewed in 5 years, looking at how we advocate, our strengths, our methods that are successful, and where we can grow. We have been known to be the leaders in storming the UNGA through Twitter. And we have done it also for WHA. We've done it multiple times. One of the times that we did this in collaboration with the G4 Alliance, we reached almost 4 million people. We have reached the heads of the sessions and member states through social media multiple times. And that's leveraging the network of nearly now 50 national working groups. So we had been the group that was technologically savvy. So we were spearheading, bringing in technological advances into advocacy when Clubhouse became popular, which is now not so much popular, and people are moving to spaces on Twitter. But during the pandemic, Clubhouse was very popular. We actually hosted 2 official side events on Clubhouse pertaining to surgical care for the 76th UN General Assembly. We have delivered statements at high levels at the listening sessions and have contributed to statements that were read and delivered at the World Health Assembly many, many times. So with advocacy impact over the 10 years, students have been, or trainees have started from a place of, what do trainees even have to offer? And that's a very honest view that was given to trainees at that time, to becoming leaders in global surgery advocacy. When I say leaders, I'm not exaggerating. You are the leaders because you are the experts when they come to you from other NGOs, from groups that have members who are many years in experience ahead of you and ask you for advice. That shows that you are leading this world. You are a leader in this ecosystem. And leaders in training global surgery advocates. So you're not only leading in advocacy yourself, you are now training future advocates for global surgery at every level, whether it is through workshops for social media engagement or the workshop and course that was actually developed in InciSioN last year, training for fundamentals of advocacy. That was a landmark course. There is nothing like it in the world, and it was a major step towards building a future for advocacy. Speaking of education, InciSioN has always had capacity building within itself for its members. During the pandemic, we had a 6-episode webinar series that actually reached over 20,000 views online. So 20,000 people were touched by the training and education that was provided by this organization that is completely led by trainees, and it was done for free. We talked about the advocacy course. In terms of global surgery education, currently there is nothing in the medical school curricula. However, InciSioN has developed the first study of the interest of medical students in global surgery education. So you are the demand side of global surgery education. Global surgery is a 40-year-old field, nearly or more so 40 years, more than 40 years old academically, if you look at it. However, the formalization of this core curricula for global surgery has not happened yet, but it will very soon. And it will happen because students and trainees are asking for it. The demand exists, so the academia will respond. And InciSioN actually carried out this study in over 20 countries. There is no bigger data set or any comparable data set on the interest in educational resources for global surgery in the world. Last but not least, Students and trainees currently lead the largest global surgery conference in the entire world, where you bring in keynote speakers, panelists, you have a full scientific program that has been developed as part of it, you do workshops. The abstract presentations and scientific program of IGSS are at such high standards that the Association of Academic Global Surgery and Women in Medicine Summit have both borrowed officially your process so they can have their abstract process done as well. So you're setting standards. So in education, again, we started from what do trainees have to even offer? Trainees shouldn't set curricula. That was something that I was told multiple times. Now you have showed that you are creating the demand for global surgery education. You have showed evidence and you have showed that you can lead in this aspect as well. You're leaders in creating fundamental courses to introduce what global surgery is across national working groups from Nigeria to Somaliland, Somalia. I have seen courses by the national working groups touching on this very subject, training their members locally about what is global surgery. On a global scale, the global body InciSioN has created courses that teaches research, teaches advocacy, and educates people about global surgery, all for free, mind you. So you are a leader in global surgery education in many ways. In research, we started with participating in research projects that were outside of InciSioN. And yes, they were very high impact, World Bank, WDI, and that was a very big deal. But then we didn't have anything within InciSioN. So we created our own research proposal process where students and trainees learned how to develop research proposals in a process that is comparable to a R01 NIH proposal program in the US. And they learned how to review it properly and create their own projects that can be disseminated through the network of national working groups. We collaborated with Lifebox and Ariadne to evaluate the surgical safety checklist across 20 countries, developed our own dissemination protocols, developed our own social media protocols and calculation of the impact of the survey so that we can look at also our processes of data collection. We developed the program that taught research in a multi-modular course and increased research education across the globe, because if you don't train people for research, then you don't have a research workforce that can study what needs to be improved in surgical care and find ways that can improve it. Finally, the Journal of Global Surgery, the first journal dedicated to our field, was formed. And because of the high impact and high standard of research that InciSioN has set, and students and trainees proved that they could be part of that conversation and not just be the data collector for a study that was given to them, InciSioN chairs have seats on the editorial board of the first journal that is dedicated to this field. So, again, what do trainees have to offer to research? We changed the entire paradigm. We brought in issues of capacity building, equity, and giving a authorship spot that is dedicated to students and trainees, and created all these internal processes that have now been exported outside of InciSioN as well. So in many ways, again, you are leading in global surgery research. So I have been part of all of these processes. It's been the adventure of a lifetime and truly a privilege to work with everyone who's been involved on all of these efforts and different levels, different capacities, but it has been a near decade, hundreds of us working together across the globe. I have learned some personal lessons. This is the only part that is personal to me that I want to share with you. Lessons learned. First and foremost, the whole key to the success of the decade was that students and trainees understood the responsibility they hold in this space and their own value. Nobody else is going to come tell you that. Well, maybe I shared some of it today, but you need to understand today and for the future, what is the value of your voice as a trainee? What is your power and what is your responsibility in this space, and own it. Once you do that, you will be unstoppable. Mentorship and sponsorship have been always key. We have had a passionate, highly motivated, educated group of individuals who wanted to do a lot of work in global surgery, but we also had support of many mentors, countless sponsors who have opened doors and supported us and guided us throughout. And now your generation has my generation and the generations before to support you. Remembering that leadership is about creating opportunities, and it's for creating opportunities for everyone else. Because when you do that, everyone grows together, and inevitably, you too, as a leader, will have opportunities. But when you focus on everybody else and your team, you will definitely succeed. To solve a problem today, you need to understand the history and you need to have a vision for the future. Otherwise, you will create temporary solutions that will come back to harm you or create bigger solutions, bigger problems for you in the future. And finally, you need to remember that we will always be stronger, do better, and go further together. That is the strength of the culture of InciSioN, the equity, the camaraderie, the friendships that exist in this field. And what is for the future? What I see for the future, in my humble opinion, is that I think that we're going to go back to the front lines. It's time for us to go to the front lines of global surgery again. And the front lines are not at high-level meetings only. They are actually where the patients are. And we need to become more patient-focused, not only echoing the voices of patients, but including them in the processes that we are developing. We are advocating to each other, advocating to policymakers. Who holds the vote? Those policymakers are in office because people vote for them, people who are your patients. So we need to go to our patients. Policy and implementation is also the next stage of global surgery, and students and trainees need to start occupying that space and thinking about how they can be effective in those spaces. And we are looking at transdisciplinary approach, again, bringing in not only physicians, NGOs, nurses. We have so many other people in the ecosystem of global surgery that are often absent from our conferences, from our conversations. This panel is excellent because it's so interdisciplinary. But when I talk about transdisciplinary, I mean, where are the patients? Are we bringing the patients to our conferences? Are we hearing their voices when we discuss global surgery? Not just us echoing their voices, but letting them have their own voice. Ultimately, future is you. And you are the future of the operating room. Two excellent examples I can give you is one, Dr. Mohamed Omar. He is the former chair of InciSioN Somalia, and he was one of the representatives of the country of Somalia in the PASHIFS meetings. If you look at the meetings, he's standing up front. He is a member of InciSioN. He was hosting the conference for InciSioN 3 years ago. The future of global surgery is each of you. And today I was watching the Summit of the Future a few moments ago. There's a call for intergenerational collaborations and youth leadership and youth involvement rather than tokenism. I think we have done some part of that in the last 10 years, but there's so much more to be done, and it all rests on your shoulders. Thank you so much. And with that, I'm going to turn back the mic.
Okay, thank you so much, Dr. Madani, for your sharing. It was a wonderful introduction to InciSioN and what we do. And I have to agree with you that we all believe teamwork does make the dream work. Thank you so much for joining us and always making time for us. So next up, I would like to invite Miss Almontaha Hassan for her sharing session.
Hello, everyone. I'm very happy to be here, and thank you for all your efforts, and thank you for Miss Madani's speech. It was very informative and very inspiring. So today I will technically continue speaking about what Miss Madani spoke, because I'm going to highlight the importance of the organizational and team excellence and their role in promoting results-driven advocacy results-driven. I mean, to clarify that all what Ms. Madani mentioned did not happen by coincidence, and it was a result of a dedicated work, organized work with a vision, mission, and excellent team. So I will rely on also in my speech on my experience in the Sudanese Consortium for Surgical Development and being a fellow, SOTA Care Fellow at the G4 Alliance. So basically, when we're speaking about organizational and team excellence, we are basically talking about forming the whole work being done, regardless of the level of advocacy, whether it's national, international, or even global. It's important regardless of the level, regardless of the nationality, even regardless of the scope, whether it was for health, for food, for poverty, etc., etc. Starting from the organizational efficiency, we are speaking about developing mission, vision, strategies, and everything, and all the efforts should be like moving around all these things, because when we have dedicated goals, dedicated mission, vision, we are like walking and working to achieve them. And consequently, our efforts will be organized, will be more, what's the word? Focused. They will not be scattered, and we will always have specific KPIs, targets that we want to achieve. Having all these mission, vision, even resources, the networks, resources, regardless of they were like funds or tools, subscriptions, or even collaborations with public policymakers, won't be able to be to happen or to be like facilitated without an excellent team. So promoting the excellence of the team, building the correct people, the correct capacity of people, organizing their efforts toward the specific mission and vision that were already set, is a key role of deriving the excellence of the organization and driving the success. I'm saying that because I was responsible of leading the change of the Sudanese Consortium for Surgical Development after the war in Sudan. I'm from Sudan, and the war started from 2023. The Sudanese Consortium for Surgical Development efforts were stopped because of the massive change that happened in Sudan. But yet the leadership of the consortium insisted on continuing the work even after the war. And this happened maybe last year. So the first thing the leadership thought of is promoting an environment that attracts the right people who can work in these circumstances, in these difficult war circumstances, to be able to make a seen efforts or seen results. So all the cycle, me being the leader of the committee of enhancing the operations and making the change all over the Sudanese consortium, and to enable the wheel of the consortium to work again, we started like with the situation analysis, understanding the challenges, understanding the current scope of the Sudanese environment right now, revisiting the vision, mission, and building the teams to be able to make a real impact. And this cycle was not easy, was full of challenges, was full of delays, was full of struggles. But because we had a mission, a vision, and aim for it, we were able to reoperate the operations of the Sudanese consortium. And now we started our advocacy efforts. We have our prostate cancer campaign is going on. The InciSioN campaigns are also going. We started our research efforts, and even research are now dedicated to the current war conditions in Sudan, mobilizing even on-ground people in Sudan, trying to also do the fellowship programs that we want to, through them, to equip the Sudanese academic professionals or staffs on ground with the proper knowledge and skills that will help them excel in their careers. Also relying on my G4 Alliance, being a SOTA care there, it was not different. It also all the efforts were connected with mission, with vision, with strategies, with teams that are dedicated for the efforts of the advocacy. And no matter the challenges are, no matter how the funds or the circumstances are difficult or tight or very unpredicted, teams and vision always make sure that these efforts will reach out to an end or give a desired outcome. So thank you so much. This is what I wanted to reflect based on my experience.
Thank you so much, Ms. Almontaha Hassan, for sharing your journey with us in advocacy from the consortium and also G4 Alliance. It's great to see what you're doing out there, and I'm sure we will continue to. Thank you for joining us as well. All right, so next up, we will have our sharing session from Mr. Santiago.
Thank you. Thank you, everyone that have shared their experience. Good afternoon. It's an honor for me being here as youth ambassador and director of partnership development and engagement at the UNESCO Center for Peace. We have, as Djoken has explained, some of the cornerstones of our work at the UNESCO Center for Peace. We have a lot of experience based on SDG 3 Health Initiative and other parts of the organization. But additionally, I'm also a medical intern at the University Hospital of La Samaritana here in Colombia, in Bogota, in the capital of Colombia, from University La Sabana. So I have seen firsthand the need of moving forwards towards that objective of the 2030 agenda of the SDGs of global surgery in order to achieve this, so we can give the 100%, not 20%, 50, 40, 60% of the population the surgical needs they need, but the 100% of the population. One of the cornerstones of my work related to this, what has been in SDG 3 Health Initiative, is a initiative from UNESCO Center for Peace. It's a project that is aimed basically of providing essential medical care to those most in need. In recent years, since the start of this initiative, we have conducted some medical missions in countries like Uganda and Nigeria. We tried last year to have one here in Colombia, but due to security issues that I think is something sometimes we don't take into account preparing these medical missions, the term of security backed down the medical mission. But in Uganda and Nigeria, we had a really, really, really high success. Our focus has been based on diagnosing non-communicable diseases in a population that doesn't have access to medical services, conducting medical checkups, and providing pediatric growth and development consultations, as the pediatric population is one of the most in needs in these vulnerable populations. Each mission for us has been a clear example of how the collaboration between healthcare professionals and the community leaders can generate lasting and positive change. The missions we have conducted, sometimes these missions create a one-in-lifetime impact, but in the way we have tried to implement these missions, it has created a lasting and positive change. However, we just don't limit these efforts to just the direct intervention. We also strongly believe the importance of education and awareness. So through this initiative, we have organized monthly conferences based on public health topics ranging from drug abuse to youth mental health, feminine hygiene, early detection of breast pathologies, because our mission is really clear to raise awareness, especially among young people, and empower them with the knowledge they need to make informed decisions about their health and about how they can also make something in their community. That's why we have also implemented at UNESCO Center for Peace is the InciSioN summer program. This summer program, we have introduced in the last 2 editions new program that is Local Project. Local Project enables young people to develop community projects aligned with the Sustainable Development Goals, where it's in fields of health, economy, infrastructure, education, gender equality, among others. Because we know that young people, they have big ideas and genuine desire to make this world a better place, but sometimes those ideas stay in a brainstorming ideas, and they need an impulse to go further and take the next step. We aim as an organization to provide them with the tools and the support they need to run these projects into reality. As all of you, I'm convinced that the innovation and the collaboration are not just abstract ideas, but tangible realities that when we work together towards a common goal, we can achieve it. Each one of us, from our areas of expertise, we can make a difference. I look forward sharing more experiences with you, answering the questions, and most important, learning for the more experienced panelists that are here, that I would like to learn about you, and also continuing our journey towards a more just and equitable and healthy world for all. Thank you.
Thank you so much, Mr. Santiago. It's really nice to see what you're doing with UNESCO, and even Mr. Djoken has mentioned earlier that you've joined them very early, and I think you're leading the way for all of us. Thank you for your sharing. Next up, we will start our Q&A session, and for this, I would like to pass over to my colleague, Meyrem, to continue the session.
Okay, thank you, Arul. First of all, I would like to thank every one of you, dear panelists, for sharing your experiences and for your insightful interventions. Now, if anyone has any questions, please feel free to unmute yourself or type it in the chat box. As we're waiting for questions, I have a question, if I may, for Mr. Guy Djoken. Yeah.
Yes, I'm here.
Yes, thank you. So, how can young professionals, especially those outside the medical field, contribute to surgical developments and humanitarian efforts in their communities?
Okay, thank you for that question. That is very, very acute. I'm saying this, I'm trying to use some medical terms, right? Since I'm the only one that's not a doctor here. Acute. But as you know, I shared the experience of UNESCO, something that was started by someone just linked to news, and that today became something that's real. And so we live in a time where I say, thanks to science and technology, people could learn things from a very remote place. Today we have telemedicine, which is becoming a reality. It is true that in some part of the world, they don't have medicine. If you were to try to have the ratio between the number of medical doctors we have and the need, we are 1,000 light year in order to achieve that. So the only way we are going to be able to do that is to somehow empower and train. And not just train those who are in city centers, but those who can be in remote places. I see, let's just say we have an event like SGT3, they do sometimes, they go to remote places. When they go there, they meet challenges. But the same way, they go there, and for a week or two, they're able to provide health to those in need. Some of them that need also for decades. We could build on that model so that next time, let's say, because they are planning, they may be going to Cameroon next year or to any other places, but let's say when they go there, they don't just have medical doctors that are coming to heal people, to provide services, but to have among them those who can go and train. I'll say train the trainers, some kind of mentality. That's, I don't know if, but having people that will get up, go to places where they have difficult access and train and get people locally to give them some of the basic knowledge that they will need in order to train our people. We have to know that, yes, today we're in the 21st century now, right? But medicine from the beginning was something that was not totally coordinated and things like that. Even right now, I speak in the jungle on Amazonia, where Santiago was, when he went there when he was 15 years old and learned a lot. I think that actually is one of the reasons he's doing medicine today. So there are a lot of places that they don't actually need a certified doctor to do things. But people that have some knowledge about biology and things like that, we are not want them to turn them into doctors because they are not, but we know that in an area where we don't have enough doctors, they could have some of those basic needs that could actually make a difference between life and death. And I think that's one of the things I will propose, that we empower, we learn, empower. We could even have, again, I was very impressed with what Madani said, the number of people impacting. So we can build on that and then get some kind of training. Like right now, in the past, in order to have a CPR training, we needed to go in a specific site. But today, thanks to technology, you could stay in your room, learn your lessons, at the end, boom, CPR trainer. So those are some things I think will help us moving forward. Thank you.
Okay, thank you so much for your answer.
Thank you.
I have a question as well. Just a continuation from Mr. Djoken's answer just now. So in resource constraint settings, maybe our panelists can share on what are the challenges to implement innovative surgical practices and technologies, and how do we overcome them?
You have to always tell who you can identify a person or tell the first person to, so that like who is looking, who's answering. So do you have someone in mind? You like the floor to go to anybody? So
it's open. Anyone who would like to share their views? Ways to overcome the challenges?
I guess I'll start so that we'll break
okay.
that.
Yeah.
Thank you, Mr. Djoken. I agree. I think the first way to overcome the challenges, we have to understand that there are similarities across the world where these challenges are faced. However, there is no one-size-fits-all solution. And everywhere we go, the best way to overcome the challenges would be to tap into that community, because the communities that are there, they know what the issues are and they actually know what their resources are. I have worked for period of time in part of some of my work in global surgery on a process called asset mapping, which focuses on developing a map of assets that are within a environment or a collaboration that you want to form in global surgery, rather than looking at a needs assessment first, because the needs assessments suggest essentially a hierarchy and a power imbalance to be created from the get-go in that relationship. So if you are facing a challenge in bringing in an innovation to an environment, I suggest, looking at the assets that are already existing in that environment. And the primary asset is always people, and then looking at, other resources. What is the infrastructure? If this is something that, is, for example, the latest imaging technology, what is the infrastructure? What are the cultural values? What are the financial values that are existing that could support it? And what are then the barriers? And to understand the barriers, we have to understand the community and tap into the people there and find solutions together with them. It should be led by the communities on the ground. We cannot dictate a one-size-fits-all answer, in my humble opinion.
Thank you. I would dare to just continue, just to reiterate what she's talking about, something that goes in the same line. When we read history, and we know it's a fact, I know people have criticized me for saying that we currently live in what is called a world that's dictated by the Western. It's a Western-centric world, okay? And, they went to Africa to colonize and civilize people. They went to Americas to do this. Again, this was just a couple of 100 years ago. It wasn't too far away. So as we come now, sometimes people actually look, you are coming for to help them. But at the same time, you have to make sure they understand that and trust that you are coming to help them. And culture is a critical part of that. Go in a community, if they have what they call a chairman, and you come and say, no, this person is bad, is blah, 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 you are wasting your time over there because you are breaking that trust. So some of things, find a way to get accepted, to get people to know that you are here for helping. And one of those things to do is to go through cultural sensitivity training. Okay? Before you go somewhere, you learn about what is real. I'm here right now, I'm talking from China. Earlier today, we're having dinner, and I said, everyone was drinking warm water. I'd asked for cold water. Someone came to me, are you sick? Again, you see? So those are little things that may not mean big to you, but let's say you go somewhere, you're trying to help them to get to be healthy, and you are drinking cold water, and they're in their head that no, if you drink, there's something that you should be drinking warm water in the room temperature. So I'm just using that as an example of saying that some of the things lie in the just understanding people, their cultural makeup. And then that could help us go a long way. Because again, you are a medical doctor. I don't want to tell you about placebo, but we know that it's very, very important. Once someone embraces you and accepts you, you are halfway through the battle. Thank you.
Yes, thank you for your answers. I have another question, if I may, for Mr. Santiago. So, as a UNESCO Youth Ambassador, what strategies have you found effective in motivating youth to get involved in global health and activism?
Well, we might all know that sometimes teenagers are kind of difficult to get motivated to do something, except if they are already dreaming about it. The actual population of teenagers, of youth, they are already like what I have sensed, if they are carrying kind of sometimes anger or like frustration to do something, and they are sometimes restrained by their age, because uh, adult people say once you grow up you can go and do this, once you grow up you can do these sort of things. So giving them the spaces, and our strategy has been that during at the summer program, is giving them spaces where they can speak freely about their desires, about their ideas, and avoiding those restrictions that sometimes are imposed to us during schools, in our early years in university, and in some other places, even in our homes, when we are restrained. No, this is a adults conversation, please go to your room, or things like that. So when you offer young people spaces so they can speak freely about their ideas, about their motivations, the need of a strategy to motivate them to do something about it sometimes is not even needed to do it. Just giving them the space and the safe that they can speak freely, it's what the actual youth population needs, because they are already frustrated that they want to do something, they want to be a active role of the society at different levels, of course. But the experience I have had during the last 4 or 5 years working with the summer program and with youth population, not just from Colombia, but from Nigeria, Mexico, Peru, the United States, and many other countries. uh, we have a lot of young people that are just waiting for a small chance to speak up, a small chance to do something. So the the population of young students are already motivated. That for me, it's like they were born motivated to do something because of what they are seeing always in the news, they have seen in social media, in TikTok, in X, before Twitter, and things like that. It's the world needs to change. We are moving forward next to the future. We're trying to make a world a better place from our presidents, our mayors, our leaders, but they see no actual progress, so they carry that frustration, they carry that, and they turn that into a motivation to be them, that the actual persons to do something. So our strategy, from my side and from UNESCO Center for Peace at the summer program, is giving them that spaces, giving them the tools to do what they already want to do, and focus all that energy, all that frustration into a positive leadership and into positive impacts.
Yes, thank you. That was very true. I have had like personal experience with the frustration of having ideas, brainstorming, but not being able to actually make an impact. So having mentors or organizations like InciSioN have offered me like a lot of opportunities to be able to bring that forward into real change. So that's very true. And thank you for your answer. Dr. Madani, I think you had a question to ask.
I do, if I may. I have a question for my co-panelists. I think it is wonderful that this panel is so multidisciplinary. I am learning so much from just hearing you speak and talk about your experiences. I really appreciate that some of our members on this panel are not physicians, actually. I really, really appreciate that. That means so much to me personally, and I know for InciSioN it means a lot. How do we engage better? Global surgery is very siloed. Ever since the day one that I stepped into events for global surgery, we've talked about these siloing. We have tried to bring in other members of this ecosystem because I'm not going to call them members. You know, I like a better word for it. It's owners, other owners of this ecosystem, because everybody who does anything that helps surgical patients is part of this ecosystem. How can we bring you and more of your colleagues to more global surgery events? I hope that this was enjoyable enough that you will come back to us, but give us some ideas, because we really, really would like to bridge this gap, because it is really hindering the progress of the field, I think. Thank you. And please, anyone jump in. Whoever is excited, jump in. I'm not going to name names, not to put anyone on the spot, but I hope I hear from all of you. Thank you.
I guess you can hear me now. Okay, so the one thing that I really love about Santiago's answer was that space, okay, empowering young people. Because I would tell you, we just have over more than 200 young people in July in a program run by young people, okay? People tend to say, Guy can do this, can do that, but they don't understand that I'm able to be in many places at the same time, do so much, not because I have young people that actually are empowered to be able to take leadership. And we all know that we cannot learn without making mistakes. But unfortunately, when young people sometimes do what I call honest mistakes, we go so hard on them that in the rest, they're scared of making mistakes anymore. And that's one thing that I've noticed. I have one of our facilitator, a young person that, again, many years ago, I'm sure Santiago knows, of course, they were young people. Technically, we're not supposed to be drinking alcohol in the program, okay? But yet, sometime I realized that, it happened, and I was very tough because, again, they broke the rule. And guess what happened? The next year, one of them actually applied, he came, and guess what? He became one of the best because he learned from that mistake. Okay? So when you just empower them, not just to the knowledge, but also allow them to make mistakes and tell them that, or ask questions and say, this is possible. So activism is what I am all about. Okay? I've seen myself as a social justice activist. I work with very major organizations around the world that work for human rights, civil rights, and things like that. And activism is the lifeblood of the future. If we need change, we need to plan activists. I have a project that most have not heard from it, but they may be, this is a platform I feel comfortable sharing with you. I think the world is in need an organization that I would like to call Activists Without Borders. Okay, I was teaching a course in a local community college called The History of Civil Rights in the United States. Yes, people see the United States, a country that has so many problems. Yes, we have police that are racist, we have decent things like that, but yet, I would tell you, I'm so proud to have the citizen of the United States because, again, it's a country that have a system that enables the system to improve, to self-improve, despite all the faith, no country is perfect, right? It's all the same. So activism is what has led this country because so creating a structure that allow young people to be activists. Sometimes I've asked many times, what's an activist? The simple answer for me I've given again and again is that, and most people in life, sometimes when they see something that's not right, they look away and hoping that someone is going to step in and do that. For me, an activist is just someone that sees something that's not right and say, what can I do to change that? When we allow people to do that, and I think that's the first step in, again, what I call creating activism, getting people to know that it's okay. Many are living in a country where authoritarian, where when the police never come there to help them, but to torture them, to do this, where parent tells you, don't do this, don't do that, don't do so. So for us is to start to unpack those things that we've ingrained in our body and get people to know that yes, mistakes are okay as long as you're doing what I call, honest mistakes, right? In the process of learning, organization, and then when we do that, let young people be able to try to find that energy, or something that get them to move, and then use that to create a group. Surgery is something that we all need every day, but people don't even think about it, right? So you have an opportunity. Everyone to be happy, everyone to be healthy. Without help, there's nothing else left. You have people that have money, but they believe miserable because they don't have help. So we have something that could sell. So let's use that. It's more of the campaign. Go to school, go to different clubs. Creating the date for the 23rd was amazing. Let's just make sure that date is known across the globe. Engaging other organizations that have nothing to do with health to celebrate those days. Because again, that's for me the way to really make this something that's going to gain more ground and have more people to get involved. Thank you.
Thank you, sir, for your insights. Miss Almontaha, do you want to?
Yes. In
something?
addition to what Mr. Djoken said, which I agree with it all, I think also we need to let them understand that it's not necessary to be part of an international NGO or like sophisticated or well-known NGO to be part of the change. So you can be part of the change locally, internationally, by doing efforts that connects you with people who are doing the same efforts, working together to create a higher impact. This is something for me, because some people say like, what change I will make if I did this, or if I am a volunteer in this XY NGO. No, I should be in a bigger scale NGO because they have more access, they have more funds. I think they need to understand this, because especially this Gen Z nowadays, they are very creative, energetic. They are born in this internet era. The trends and the influencers, they have room to make a huge impact, whether on ground or online, especially because now internet has even played a role in massive changes globally, in politics or social norms. They need to understand this. And also, I think something important, they need to understand the power of networks and collaborations, because even though if they are working locally, they need to understand that working locally with people like-minded, is very important, and then escalating this efforts to be more globally, and understand that if they are doing things locally in their communities, in an indirect way, they are contributing to the global surgery efforts. This is correct. This is from my also humble point of view.
Thank you.
Yes, thank you so much. Mr. Santiago?
Yes, just to add something that Almontaha has said that is really important, is to let them know and let them recognize that even the smallest activities, the smallest idea, it can have a big impact. I think one of the strategies we can use to get more people involved that are not just part of the medical field, of the health services fields, is first let them know that this is open for everyone, and the topics of global surgery, it doesn't just engulfs the SDG 3. Global surgery engulfs SDG 3, 8, 10, 5, and many others that they are related directly and not directly to health care and health services, but it's really important for all the people to understand that global surgery involves many other spaces, many other responsibilities, many other implications, and that it's important to have a collaboration, not just between physicians, psychologists, nurses, trainees, but also from business administration, from economics, from political sciences, from many other things. I know that one of my co-panelists had said that culture is really important once you go to develop a project. So an experience I had, as Guy mentioned, in the Amazon, I went with my school when I was 15 years old to make a medical mission and an educational mission in the Amazon in Leticia, in the Colombian Amazon. And we created a project with a really, really, really beautiful insight about dental care, without brushing teeth, about reproductive intentions, reproductive healthcare. And once we got there and we talked with the leader of the community, when we talked with the people, they were not interested at all about the reproductive health cares and things like that, because they have their own way of doing things. So we should have known that before, but if the education, for example, here in Colombia about doctors, and taking care into account that we are trained to treat patients, to treat diseases, to make surgical procedures, and we forget sometimes that once we want to do some projects like this, we have to take into account not just the diseases, not just the epidemiology, the physiology and the physiopathology of the project we're going to establish, but also the culture, the intentions, the cosmovisions of all these peoples, of all these people we're going to impact on. And that's one of the cornerstones of why we need, and how other areas of expertise are needed in this kind of initiative, as InciSioN, as SDG3 Health Initiative at UCP, as a community project of the school right next to your house. Understanding the whole necessities and the interactions of the SDGs, of the SDG3 with other SDGs, and let them, all the community, understand this. It will be the main cornerstone of bringing more people on board of projects like InciSioN and many others.
Yes, thank you so much, Mr. Santiago. Thank you, everyone, for your insightful informations and impressions. So let me check if we have a question. Okay, so I have a question as well, if I may. It's for Dr. Katayoun. What role can students and early career professionals play in advancing access to trauma care in resource-limited settings?
Thank you so much for that very tough question.
I'm sorry.
That's okay. No. I'm teasing you. Trauma care is complex. We often think about it as something that is, subspecialized, depending on where you are, and it's very resource intensive and so on. But yes, that's a trauma system. However, trauma care starts from the moment a person is injured. We have not really tapped into health promotion aspects of trauma. If you stop people in many places and ask them, who will you call when you get injured? You will get different answers. How will you get help? Do you have access to trauma care even? Most people may not have even thought about it. And this is not a problem that is only prevalent in, low middle income countries. In the United States, more than 45 million people don't actually have access to trauma care within 1 hour of where they live. We have data that shows that. We have a lot of patient education that we need to do, and students and trainees, by the virtue of the fact that they are still in training, are viewed as very innocent and sort of wholesome by the society. We have to face the facts that the COVID pandemic has created a lot of mistrust between general public and the healthcare systems, and even, you know, the WHO to a certain extent. Just look at the comments Dr. Tedros gets on any posts he makes about vaccination. That should give you a sampling of what you see. And yes, there are many trolls on the internet, but generally there has been a broken trust, and we have to address that, and we have to face that. Students and trainees can bridge that gap, because society still trusts students and trainees because they are not seen as financially motivated. So that's an area that students and trainees can be very much in the leadership of health promotion, patient education, and so on. Another aspect that they can be involved in is training bystanders and doing trainings like the one that InciSioN provided a certificate with the American College of Surgeons, the trauma teams, where basic care for someone who's injured is taught. And you don't need a fancy setup for all of those procedures. Stop the bleed. Yes, there is a tourniquet, but there are many ways that we can do it without the fancy tourniquet. And there are so many things that we can still teach lay people so that they can, or we call lay people general public, so that they can be prepared in case an emergency happens. And finally, I will say this, because it touches a personal point for me and for InciSioN, is that InciSioN members have been working very closely to create trauma systems where they don't exist, or emergency response systems where they don't exist. These efforts have been in Somaliland, Nigeria, and many other places. And it is important that we don't lose sight of the fact that you can have an impact. We've said it over and over in this call, right, in this meeting, that you can have an impact if you find the right mentorship and if you find the right people to listen to you and give you that opportunity. What we were taught when we started with InciSioN was, and this is, I'm going to quote Professor Emmanuel Makassa, who is known to many on this call, but he is essentially a champion for global surgery, the person who was behind drafting of 68.15 and is passing at the World Health Assembly. Professor Makassa's advice to us from day one was, if you don't have a seat at the table, grab a seat and bring it to the table. You have to take your own seat and go to the table. So there's a lot you can do without training for trauma yet, becoming a trauma surgeon. I'm not there yet myself, so there's so much you can do. But before even that, you have all the passion. And I cannot agree more with everyone else who's on this wonderful panel, that the youth have it. They know the problems, they see it, they have abundant energy, and they need to be supported. And as you all are speaking, I am reminded of all the support that I have received, and I'm very thankful for it. And that is why I show up to these calls with InciSioN, and many of us do. And we continue to give back to the youth, but we have to understand that we're not just giving back to them. They are going to build with us. It's not for future that is happening 10 years from now. The future is today, and they're here, and they're going to be able to do it. So I hope that was not super long answer, but thank you for the question.
No, that was perfect. Thank you so much. Thank you. I think Arul has a question.
Hi, yes, I do. So my question is for Ms. Almontaha. So, may I know what are the roles that partnerships between academic institutions, government, and NGOs play in advancing global surgery?
Okay, thank you for this important question, because practice proved that partnerships, networks are the key for the success of all the efforts. I mean, being isolated and working separately, whether academic institutions, governments, NGOs, private sector. So if you want to achieve results more efficient and have real impact on the ground, all these efforts should be coordinated and partnered together. And understanding of the importance of this important partnership, the importance of partnership, whether from the government side, from this academic institution, institutions or NGOs, private sector, is very important, because when you want to apply something, it should be based on the knowledge. Knowledge usually, and to like high. What I can say, in high accuracy levels produced through academic institutions from expertise there. So if governments want to make evidence-based decisions, or to know where to work on and where to act, it's very important to rely on accurate data and accurate understanding for the situation. This comes from academic institutions, and then government enables or force policies because they have the dominance of governing the country, or they are the controllers of the country itself. For the NGOs, they are especially in the developing countries, they are playing a huge role in bridging some of the gaps of the government. So when a mutual collaboration between the governments and the NGOs in these specific areas, if the example spoke about global health, or in this context will be national, it's very important to have this collaboration. And if we spoke about the international or global scale, the same applies for them. The collaboration between the international institutions, the governments of different countries, developed or developing, and also the NGOs will promote more efficient and good results and good impact on the surgical neglected patients, or any person in need, whether in health or food sectors, poverty, etc.
Thank you so much, Ms. Almontaha. So I would like to thank everyone, all of our panelists and participants for today's session. It was very insightful, and we actually really value all the information you've given us. This really gives us more motivation to push forward and bring a real impact into the world. So thank you very much. And as we conclude this insightful panel, we've seen how youth empowerment, collaboration, and innovation are crucial in driving global health improvements. Our speakers have shared their invaluable experiences, showing us how students and young professionals can make a real impact, starting from their communities and scaling up to national and international levels. Through mentorship, advocacy, and collaboration, we can all play a role in shaping the future of global health. Let this conversation be a call to action for each of us to actively engage, collaborate across borders, and pioneer solutions for a healthier, more equitable world. Thank you again so much, everyone. I will let Arul we want to take a picture with all of you, if it's possible. So if everyone can turn on their camera.